I'm Steve Ballmer, founder of USAFacts. USAFacts is a nonpartisan, not-for-profit civic initiative providing a numbers-driven portrait of our nation. Let's get to the facts. The single largest area of spend by government is helping to improve the lives of the less advantaged people in our society, people who are disabled, people who are less affluent, and we spend in that area $1.3 trillion, which even inflation adjusted is up from $446 billion in 1980. Quite a significant rise. Where do we spend that money? We spend that money in healthcare. This has been much in the news. Primarily, this is in the area of Medicaid, Medicaid for kids, CHIP for kids, Medicaid for older people. There's been a set of policy discussions and policy changes through the Affordable Care Act. There's a bunch of contributing factors in this area to go think about, but is certainly much discussed. $291 billion of that aid is in the form of income supports, the most significant of which is something called the Earned Income Tax Credit for people who make less income. The government does provide supplements in some case, earned tax credits, which can come back in the form of cash to match what people are, help match what people are earning. Government obviously supports housing through housing vouchers and public housing. Education support, this isn't K through 12 education per se. It's the additional money that governments provide to help educate less affluent kids, to provide scholarships, Pell Grants for less advantaged kids to attend university and community college. We continue to have $106 billion in this country spent on welfare, which occasionally comes into the news. And then there are nutrition supports, which are provided to the less advantaged, free and reduced lunches for kids at school, as well as so-called food stamps, which are actually provided under something called the SNAP program from the government, but that constitutes $103 billion of the $1.3 trillion. Visit usafacts.org to explore, to get the facts, and decide for yourself.